Hello, I'm Erin Cox, physiotherapist. We're going to talk about the radiocarpal and the ulnomeniscocarpal joints, both a little bit of anatomy and a little bit of biomechanics. So I'll just share the screen. So these are the joints that we're talking about here. So the radiocarpal between the radius and the scaphoid and the lunate, as well as the ulnomeniscocarpal joints. And we talk about the meniscal part because don't forget we have that fibrocartilage of the triangular fibrocartilaginous complex. But if we look at which bones is on the ulnar side, the ulna is opposite the lunate and the triquetrium. So the articular surfaces, so the radius and TFC are a concave surface, but don't forget we always name for mobilizations the distal and the proximal. So the proximal carpal row is convex on concave. The ulnar collateral ligament, it goes from the ulnar styloid to the pisiform, to the triquetrium, to the hamate, and to the fifth metacarpal. So it's got quite a vast attachment, and it's reinforced dynamically by the extensor carpi ulnaris. And those deep fibers of the ulnar collateral ligament blend in with the TFCC. The radial collateral ligament goes from the radial styloid to the scaphoid and the trapezium. They're reinforced by the extensor pollicis brevis and abductor pollicis longus, which make up part of the anatomical snuff box. The dorsal radiocarpal ligament is thinner than the palmar ligament and extends to the scaphoid, lunate, and triquetrium. And the palmar radiocarpal ligaments it's a broad membranous band, and the anterior radius and styloid to the lunate, the scaphoid, the triquetrium, and the capitate, and each one is named by its attachments. The palmar ulnocarpal ligaments, now more on the ulnar side, it's round and fasciculous. And the ulnar styloid and anterior articular disc goes to the triquetrium, the lunate, and the capitate. And we looked at this also when we looked at the TFCC anatomy. The capsule, as we already said, it's continuous with the inferior radioulnar joint, but there should not be an opening between the TFC complex and the distal radial ulnar joint. The radiocarpal ulnomeniscal joint classification is synovial, compound, again, as we just said, it's all in the same capsule, modified ovoid joint with the interposed TFCC, in which case you could say that it's complex because it has a disc in between. The radiocarpal joint, the degrees of freedom is 2. We have flexion, extension, radial and ulnar deviation. Closed pack position is full extension. The resting position is slight flexion with ulnar deviation, and the capsular pattern, equal restriction of all movements, but especially flexion and extension. The normal end field would be capsular for flexion, extension, ulnar deviation, and radial deviation, because the radial styloid extends further distally, can be considered a bony end field. Osteokinematics, the flexion and extension is an impure swing in a sagittal plane, and there's a conjunct adduction or ulnar deviation with flexion. And then with extension, there was more of a radial deviation. The range of motion achieved by simultaneous movement of the radiocarpal and the metacarpal articulations, all the carpals move in the same direction as the main movement. That's considered with osteokinematics. Don't forget the joint surfaces are different, so arthrokinematics, it may be in opposite directions, but the overall bones in osteokinematics will move in the same direction altogether. Articles refer to dart throwing because this gives us our combined movements. So if we're going to throw a dart, we have our extension and radial deviation, and if we want to throw it, we've got our flexion with ulnar deviation. Now, the contribution of movement. So for flexion, we have more flexion in the mid-carpal area, and for extension, there's more of a contribution by the radiocarpal joint. In radial ulnar deviation, so it's an impure swing about a sagittal axis in a coronal plane. Of course, so then we're going to have their axis going sagittally, or if we were in our anatomical position, then it would be this way, and the radial deviation toward the radius, and ulna this way. Distal row has greater contribution to range of motion than the proximal row. All carpals move simultaneously. So radial deviation occurs primarily at the mid-carpal row. Ulnar deviation occurs primarily at the radiocarpal joint. So radial deviation is 15 degrees, ulnar deviation is 30 to maybe even 45, but just to note that the radial deviation will be less because the radial styloid extends further distally than the ulnar styloid. Thank you. More later.